Hi, I'm Cynthia Ng. You're tuning in to AWANI Review. On this episode, we will be taking a closer look on rehabilitation medicine. Now, joining me on the show is Encik Hanafi Salehuddin. He is the CEO of ReGen Rehab, which is Malaysia's first rehabilitative private hospital licensed by the Ministry of Health. Thank you so much, Encik Hanafi, for having me here at your hospital.
Thank you, Cynthia. Thank you for the opportunity to actually come here and, give me an opportunity to actually showcase what we do.
Yeah, I think the topic on rehabilitation or rehabilitative services is not something that is often talked about within the healthcare realm. Maybe we can start with that. If you can walk us through how is rehabilitation medicine important in the larger spectrum of healthcare in Malaysia?
So, I think firstly, perhaps let me use this opportunity also to share what is it exactly about rehabilitative medicine that's important to healthcare. I think one point, or 3 points actually, people should appreciate that the goal of rehabilitation medicine is all about recovery of patients, and we are all about having the goal to reduce complications, promote recovery, and also improve their functionality. So with these three sort of goals set out for each of our patients, that's actually culminated in our mission at ReGen Rehab Hospital, which is about bringing you back. So we aim that all our patients that come through our program will achieve their goal of having been able to live their life to their full maximum potential. So if they, for example, actually suffer from a very terrible stroke, right, especially for the elderly, what happened then is that they will need time for the treatment at the acute hospital. And this is where we come in with the post-acute setting. It's all about how do you make sure that the patient can return back to their optimal function, they can live independently, and also enjoying a better quality of life. Because, especially the elderly, as Malaysia heading towards aging population, the key here is all about how can an elderly actually live independently, and also sort of reduce the burden for their dependents as well.
Right.
Yeah, so that's one area and why we are here actually to promote and more awareness on the rehabilitation medicine.
I think, as you rightly pointed out, rehabilitation services in Malaysia, to my knowledge, they're mostly concentrated within a hospital setting as a secondary or tertiary care. A specialized hospital focusing on rehabilitation, there's just a number of them in Malaysia, maybe one or two private ones, and then you have a few maybe in general hospitals. Talk to us, why do we need a more specialized setting for rehabilitation, and where are the areas that you think are underserved when it comes to rehabilitation?
So I think for rehabilitation medicine in Malaysia, it's nothing new, but where we think that it will advance Malaysia's healthcare is we should start looking at other countries as well, as a model on where our healthcare can grow. So I give you an example. The US has, being a very mature country and developed country, has now started seeing the acute hospital being the place only for treatment, only for treating any conditions that require intensified focus from the specialists, for especially neurologists, the orthopedics, or whatever the surgeon is, to just treat and stabilize the condition. And you start also notice that in the US, for example, I'm just giving as an example because they are more advanced, you start seeing that they actually have now a more specialized hospital looking at treatment, looking at recovery, looking at how do you move away from acute setting into the post-acute setting. And this is what we're trying to bring to Malaysia as well as a concept. And the two reasons for this. One, from a clinical standpoint, having a dedicated specialized hospital focusing on rehabilitation, it gives the team the ability to actually focus on what matters most, which is actually about recovery. So we have a multidisciplinary team led by the rehab medicine physician, with the therapists together with the rehab nurses and all other ancillary team. We are actually talking about focus on the recovery of our patient. So our patient, for example, at most will stay maybe around 3 to 4 weeks, which is very long in an acute hospital setting, especially for private hospital. So this is where we put all our energy to make sure that they will meet their goal, as Ashley mentioned earlier. And this is very important as as we move towards having the recovery is more optimal. especially as we try to bring more value to Malaysia in terms of healthcare. The other part is, if you want to continue rehabilitation in an acute hospital, you probably have to end up actually paying a lot more in terms of the cost, because one day in acute hospital is actually more expensive than having it in our hospital where it's more specialized. Our back on the envelope calculation and our estimates suggest that if you can split the episode of care between an acute hospital and a post-acute hospital, you can actually save around 30% of the patient bill. And I think that's very important, especially if you want to achieve the same optimal
And this
level.
is a private hospital setting?
Private hospital setting.
Okay, all right. Of course, our conversation today is mainly revolving around private hospital setting. Financial barrier, you just pointed out, it is a key reason to why a lot of people do not even seek treatment or get diagnosed. And rehabilitation is perceived as a luxury health service. Is this a misconception?
Well, I will also just preface to say that it is certainly you require some cost to make sure that you can recover well, especially within the first month of your treatment. But I think what people may miss out is actually to look into the total care and recovery, especially post treatment at the acute hospital in longer term. Let's say it will take 2 years as one time horizon, right? Of course, one can take a view that I'll just want to bring my patient or parents back to home and maybe let the treatment continue from there. But what happened is that the recovery isn't optimal and you don't achieve the goal.
And you prolong it even
and you
further.
prolong it, and you may actually incur a much higher cost to actually maintain it to a certain condition and state. Whereas where we aim at is to make sure that you recover as much as possible, reach that, so that the subsequent cost can be reduced substantially. So it's I wouldn't say that it is cheap, but certainly it's reasonable if you look at it from a longer term horizon actually.
Okay.
Yeah, this is what we're trying to advocate to all our patients. Look at it from a longer term. Look at it on how much cost that you need to make sure that that taking care of your loved ones is sustainable in the long run. Yeah.
But the problem with Malaysia, I think more than half of the population still relies solely on healthcare coverage provided by the government. And to this day, out-of-pocket health expenses is still quite high. I think about 30 to 40% of total health expenditure, which is well beyond what's recommended by WHO, 15 to 20%. Just on your thoughts on that, on providing more accessibility, healthcare accessibility, especially in the realm of rehabilitation.
Yeah, so I guess, and I'm not disagreeing with that facts. I mean, Malaysia has a very high out-of-pocket expenses, and it's something we recognize with. If you want to make a sustainable business, we need to work with the payer as one of the elements to promote the awareness, to increase the accessible. And it's something that been, as a mission for ReGen Rehab from day one, is actually talking to the payer and try to promote and advance the view on why this matters in the recovery of patients. Insofar, we have a good support from a corporate perspective. I think from the corporate payer, from the third-party administrator, they actually can see the benefits, especially to their employees, on how our program actually help their employees actually return to work faster, and how they can sort of regain back their employee, especially after going through the serious conditions. I think this actually serves as a good model for other insurance players to start take note as what we can do, and actually we can now start building up the data points to support our view in the future. I mean, in our future engagement with.
But currently, there is still quite maybe just a couple of insurance providers that cover rehabilitation.
That's right.
Okay. What's stopping them?
I think it's a bit like wait and see, and I think they will still want to see whether the regulators actually sort of taking a view and especially from Bank Negara, from Ministry of Health, and where does it fit in the longer healthcare journey. I think where the good news is for our list of our outpatient therapy, there is still some coverage for that. So the insurance actually cover for this, and now it was more like let's bring this conversation a step further and see how do we cover this from a more holistic standpoint, covering both outpatient and inpatient, and how do we expand the services to make sure that the patients can enjoy the benefits for rehabilitation.
And I think that's very crucial because the need of rehabilitation will arise because of demographic changes, NCDs, people living longer but with more chronic illnesses. Can you walk us through some of the more pressing rehabilitation services in Malaysia that is underserved and needs attention?
So one thing that I probably should just also explain that rehabilitation medicine covers all aspects in all ages actually. So we have program from a very young, especially in dealing with the cognitive disorder, speech delays, autism, ADHD is one example, and all the way to the elderly. For our hospital, it's actually covering all spectrum, but our inpatient program is gearing towards more elderly, and actually recognizing on where our population is heading towards. So I think the rise of NCD and also stroke, neurological conditions being one of the areas that have seen a lot more as a cause of hospitalization in Malaysia. That's where we come in, where we can offer a very comprehensive program to make sure that the recovery can be attained within that golden period of 6 months, for example, for stroke. Because, our hospital is very specialized in the sense that we have multiple gyms, pretty much at every ward, and our therapy works with the patient almost up to 3 hours per day, actually, to go through the rigorous, recovery program. We take pride ourselves that, we have patients that coming in, perhaps on stretcher, but they can actually start going home either by walking or start to walk with aid, of course. So that has always been the hallmark of program, especially those that suffers a very terrible neurological conditions actually.
I think rehabilitation is something that's often overlooked because, whenever, take for instance COVID-19 when it happened, the primary care has always been focused on treating the acute illnesses and to attend to immediate things. How has COVID-19 changed rehabilitation services in Malaysia? Has it been good or bad, or do you see more attention is being given to, especially with COVID, long COVID, and people suffering from that?
So that's where an interesting opportunity actually arises from COVID-19, because it's very new and a lot of people are still learning about the virus as well. So long COVID is something that people just, I think doctors and the scientists now more understand better, and we actually had the opportunity to use this as a platform to showcase on what rehabilitation actually does for COVID. We had 2 programs last year, so exactly to tackle this. So one, we actually launched a corporate social responsibility, where we actually offer free outpatient therapy program to our, to patients that require help to address with their long COVID, because last year low vaccination percentage yet. So the COVID impact to the patients can be quite severe, especially when you're long COVID. So we actually offer therapy program, and we still do actually until this day. And we also actually help the government to reduce the capacity constraint, especially in the Klang Valley during the peak of COVID last year as well, where we actually take in some patients from the Ministry of Health to help them with the post-COVID treatment recovery at this hospital actually.
I think another thing that the COVID-19 has taught us is that we really need a robust healthcare system that will not only withstand future outbreak, we need one that is also fit for purpose to deal with different kinds of arising diseases. And where does rehabilitation sit in this whole spectrum?
So the rehabilitation as in nature as well is actually more dealing with the post-acute, where we help the hospital, especially on the acute side, is to actually focus to take away some of the patients to give them more capacity,
so
that they congest, to decant the patients, so that we can actually now taking care of the recovery side. So that has always been our aim, especially how do we exist within the private healthcare complex here in Malaysia. But at the same, actually, we're more than happy to support any public policy that promotes more on the recovery of patients, actually.
Now, speaking of public policy, the Health Ministry is in the midst of formulating a white paper on healthcare reforms. Are there discussions to make rehabilitation medicine a priority in our efforts to improve universal health coverage?
Well, I hope they certainly listen to us and sort of recognize where we fit in the rehab medicine within the healthcare journey. And well, at the moment, we're more than happy to engage with the with the Ministry of Health on where do we support with the business, with the services. But I think I want to stress out a couple of points here. The healthcare white paper do recognize that Malaysia is heading towards aging population. Yeah. And if you look back to the WHO call to action with regards to rehabilitation, these actually form a very important part of the healthcare system, any healthcare system in the world, where they call for greater access, greater availability of resources and capacity to actually make more population that have access to rehabilitation. And that's very important because as we're heading to aging population, one area that we need to start looking at is like the dependency ratio. Malaysia's family is not going to becoming larger, and and with longer lifespan, the attention to rehabilitation actually become more crucial. Because what we want from our elderly in the future is to be able to actually live independently, and this is where rehabilitation come in a very big way. Because our therapists, of course, will have program to help. One, not just about recovery actually. The second one is also about maintaining their health. How do you keep yourself as an elderly healthy in the golden years? How do you continue to live in a very independent manner, so that you can lead a very quality life? I just want to add as well, as part of our therapy program, we don't just help the patient, we actually work with the family, train them like, this is how you continue to support your parents at home. What kind of instruments you need, what kind of tools you need, so that your parents or your loved ones can continue to live almost independently in the future as well.
Malaysia is not alone in facing an aging population. I think a lot of countries in the world are going through the same demographic shift. And just wondering, when we talk about rehabilitation and elderly care, is there a model that Malaysia can look towards, to replicate, to form a more robust and comprehensive
I think
coverage?
So. Yeah, that's quite interesting points, because the quite interesting point about Malaysia is our healthcare system is fairly unique that we can let the public and private sort of coexist. And in that sense, that there's not many countries in the world that have that kind of coexistence of public and private. One can point to either the US as one example on how do you integrate the post-acute care into the system, but the funding system there probably doesn't fit into our narrative here. The other country that we should look towards is actually Japan, where it's known to have that aging population, as large part of their total population, has been going on for some years as well. And they, if you go through their healthcare system, you can start seeing how the rehabilitation hospital, together with their aging, their senior living center or assisted living center, sort of coexist and work in hand-in-hand together, with a very robust funding system as well. So this is something that Malaysia can look toward if it's aspire to have that, health for all kind of slogan as part of the vision for Malaysia in the future.
Well, on that note, turning our attention to the business portion of ReGen, are you looking towards, or are you working with elderly homes and elderly care services to extend the range of care that you provide?
So, in terms of our partners, if it's talking about, so we are very collaborative. I mean, the nature of this business model is hospital works on, having to collaborate with multiple parties. There are two other aspects of collaboration that we are already working on. One is actually to work with what we call as provider. So we are work in close contact with other private hospitals, where we will look into how do we seamlessly transfer patients from their hospital to our hospital, so that continuity care is important. And we do actually look forward to work with other nursing home and everything, so that when a patient is done with their treatment, they can actually sort of move seamlessly as well to the nursing home. And this is one area that we would like to create, where we serve actually as a bridge between the hospital and the community, again, in addressing the aging population in Malaysia. Yeah.
Okay. Well, my next question then would be for ReGen itself. ReGen, of course, I missed out earlier in the show, is actually a joint venture between Khazanah National and an American-based healthcare company, Select Medical. Talk to us about what's next for ReGen. If this is your only hospital for the time being, what's the strategy here to grow the business?
So this is the first hospital for ReGen, and we're only 4 years into existence. We are still sort of fine-tuning the business model, and with this great location here, we're surrounded by private hospitals within Klang Valley. I think it serves as a good test case on how can this work, with other locations as well. I think it's always been our mandate to actually grow beyond just Klang Valley. We're looking at other population urban centers, either in the north or even in the south. That's always been in the pipeline. But I think what's more important is to find the right balance between the team and also the funding model, that if we can put this together, I'm sure inshallah we can have it more successfully in different regions as well. What's very key important, I must add, is the workforce as well. At the moment, the very nature of our services is we work with patients closely, and so at the core of it is we need to have a very talented staff and very knowledgeable in the way they dispense their knowledge and the treatment to the patient. So we are also now working towards having a very robust training ground, so that these services that we have ReGen in Klang Valley, in PJ here, can be replicated seamlessly across the nation actually, and not just Malaysia, actually beyond towards ASEAN as well.
In terms of staffing, talent, is it difficult to find staff and therapy?
At the moment, we are also facing staff crunch as much as other hospital. The opening up borders definitely serve an opportunity for Malaysian staff to actually seek opportunities abroad.
Yeah.
So we're working with that. But I think where we offer a very unique opportunity is actually our staff can actually work with patients to see their recovery. And it's something that I think for most healthcare workers is something that is always the best rewards.
That's what they do.
Yes. Yeah.
Now, speaking of opening of borders, the upside of it is that people are coming back in. Medical tourism was a big thing for Malaysia prior to the pandemic. How is it now? And I believe rehabilitation is something that Malaysia can really tap into, especially in ASEAN.
So undoubtedly Malaysia is one of the great destinations for healthcare tourism. I think our system serve a very unique, will serve a very unique proposition to the world actually, because our talents in this country is really one of the best. We are trained under the Western system, and yet we actually have a very good local content that we can bring it to overseas patients. So in that regards, we also joining the trend to actually promote ReGen beyond just Malaysia. I think this year specifically we went to Indonesia, where we tried to promote the brand there, and very good reception, and we already start seeing patients actually coming from Indonesia to ReGen as well for this year.
And what kind of care do they tend to seek overseas?
So specifically for Indonesia, they are also almost similar to us, very high morbidity rate due to stroke as one of the bleeding causes as well. And they actually look forward to this kind of recovery hospital, because again, we are almost number one in Malaysia, but also there's no other very specialized hospital in this region actually. So Indonesia serves a very interesting market, especially in their urban centers, where they're always in the lookout for this kind of rehabilitative services.
Okay. And what other markets look more exciting to you at the moment?
I think ASEAN is large enough for me to work with. The Indonesia is one key market, and of course the Indochina as well, large urban centers as well there for us to tap into.
All right. Well, thank you so much, Hanafi, for just walking us through rehabilitation medicine and just how important it is to support the overall healthcare system in Malaysia. Thank you so much for your time. Thank you for having me here.
Thank you, Cynthia. Thank you for the opportunity to speak to you. Thank you.